We are now joined by Dr. Bill Howitt for his keynote presentation on maintaining mental health in the workplace. Before I introduce Bill, if you have any questions for Bill, you can record them at any time. We'll save all the questions for the end of Bill's presentation. Dr. Bill Howitt is the president and founder of Howitt HR Consulting. A behavioral scientist, Dr. Howitt is known as one of Canada's top experts in mental health issues in the workplace and has more than 30 years of experience in the field of mental health, addiction, and HR consulting. He's the chair of CSA Standard 21008, Management of Substance-Related Impairment in the Workplace, as well as a part of the CSA OHS Standards Steering Committee. He is also the chief of research for Future International, which is focused on developing mental health apps, and is a member of the International Research Advisory Council at Pacific Coast University of Workplace Health Sciences. Dr. Howitt is the chief of research and workplace productivity at the Conference Board of Canada and Chief of Research and Development, Workplace Productivity at Morneau Shepell. He is a busy author, having published over 400 articles and 40 books, including Stop Hiding and Start Living. Let's please welcome Dr. Bill.
Thank you very much. So I'm just going to welcome everybody. We're going to be chatting. We have about a little bit of time. How we have these conversations in this virtual world is I'm going to talk for 20, 30 minutes, and then we're going to have you an opportunity to plug in some questions. This is a conversation that some people are comfortable having and some people aren't comfortable having. Now, I think it's important to give you some context that I normally, when you do these, I try to make sure my experiences are lined up with the audience. I have a PhD in counseling psychology. I started out in corrections as a forensic psychologist. So I spent a long time and I worked with first responders. I was in shore search and rescue with the Coast Guard. I also was specialized in what's called critical incident stress debriefing. Demobilization was my on-site scene management. And so I've done all kinds of stuff in the world of both, two types. One is I've been involved in the types of traditional security and things. And I also do a lot of work with hospitals as well. I'm involved with healthcare CAN, and I work with a lot of different hospitals as well. So when I see the concept around patient violence and creating psychologically safe workplaces, that's kind of where I work. And what my role, when I work with organizations, is to actually help them remit what are two factors. One is to remit the environmental things that from the outside the building that create mental harm and things that happen inside the building to create mental harm. And that's my focus, as well as promoting mental health. Now, when I have a conversation like this with you, and I'm just trying to get my slides there, they're clicking at. When I have a conversation like this with you, what's important for you to be aware of is that the last part of this, that is the context of who's speaking to you. So you have a little bit of my context of where I've at as a clinician, as someone seeing folks, and I've seen patients for up to over 30 years. The part that you may not also know why this is a topic that's really important to me is that, see, I'm the kid that grew up in the foster home for the first few years of life. I'm the kid who was adopted. I'm the kid who failed grade 2. I'm the kid who couldn't read or write till they were 18 years old. I'm the kid that lived with perpetual anxiety and all those different things. When we talk about mental illness, many times it happens when you're young. And when we hear the concept mental health, many times we think about people like me who live their lives with a mental illness. Now, until I told you that, you probably wouldn't have known. And so the concept around actually understanding the challenge around mental health issues and mental illness is that we conflate them. We actually think they're the same thing. They're not. So we'll kind of start with a simple little quiz for you. If I asked you what the algorithm is for physical health, many of you would probably say, exercise. You know it's diet. You know it's rest, relaxation, sleep. You know the thing, lifestyle choices. Like if you drink a 2-4 each night, it's probably going to impact your quality of life over time. And so what happens is that we know if we do things with intention, that I can reduce my risk for chronic disease, if that's important to you. Now, most people that I know, after doing this a long time, they may not pay attention to their health till they get sick. And then they get sick and they go, oh, damn, I better do something. So you think about type 2 diabetics is an epidemic proportion, but the World Health Organization says about 80% of that could be avoided by lifestyle choices. So lots of us are actually making ourselves sick because of our micro decisions. It's not because we don't know, it's because of our micro decisions. For example, because of COVID, I bought one of those things called a Stairmaster. You can't see it. Now, you probably know this, but just to make sure we're on the same page, if I get on the Stairmaster once, I don't get shredded, just so you know. Like I don't get ripped. I actually got to get on the Stairmaster all the time at my age, is to actually have, create the illusion I actually have the energy to keep going, right? And what I mean by that is that fitness matters for us. And what we do, the micro decisions we make can impact it. So physical health is about intention. Well, the challenge with mental health is that most people know what the algorithm is for physical health. Whether they choose to do it or not is another thing. But then ask them, what's the algorithm for mental health? And a lot of people don't have a frame of reference. My role today is to give you a frame of reference, to demystify some of this stuff. And also, if I have any success at all today, you'll actually be very clear of the difference between mental health and mental illness. And I just want to make sure I get this clicker thing figured out here. All right, there we go. So I apologize. This is used to this clicker thing. There we go. All right, yeah. So my role is just to make sure you're clear of the difference between mental health, mental illness, and give you a frame of reference, and to give you a kind of a couple ideas of how easy it is to have a positive impact on your mental health. And I'm going to give you again through a lens. I can only go through my experience. You see, someone who lives with a mental illness, I still take care of my mental health. And what happens is 1 out of 5 Canadians before COVID, the same status in the United States and same status around the world. I work globally as well. And people may not know, the World Economic Forum says one of the leading causes of premature death by the year 2030 is going to be mental health. COVID's going to speed that up. People like me now are with COVID, and why this is an important conversation for you is that if you're tired, fatigued, irritable, or no people around you because of all the uncertainty, the real challenge for us, and we know this from disaster management, we know this from other incidents, is that wars too, is when people come, the war is over, everyone's happy. When the people come back, now they have to reintegrate, reprocess, and that's where a lot of healing happens. Once all this COVID stuff happened, we now have to deal with the financial reality of what just happened. And that's going to create a lot of strain. So the year from 21 to 25, we'll get through it. It's going to be hard. And so what we need to do from an objective perspective is actually not have this Pollyannish look that many of us do, is happy, good, bad. Life, mental health is not about happy or sadness. Mental health is really about being comfortable in your own skin and having the confidence that you can actually deal with the demands put in front of you. And when we can't do that, we get overwhelmed and we don't know what to do with it. We'll talk about how people can engage in at-risk behavior. Now, one of the things for me when I go through this conversation with you is to start to give you the indications of some ideas of early behaviors that you can do to actually reduce your risk for any type of mental health challenges. Now, regardless if you have a mental illness or not, mental health is important. And what I mean by that is sometimes what people do, again, I've said this 3 times so far, and I'll probably say it a bunch, they confuse these 2 constructs. They're separate. And so what happens when I see patients, I deal with them on a continuum from mental health to mental illness, mental illness low to severe mental illness high. It's on a scale, low to high. But on the other axis is mental health. So a patient can come in with really, really severe mental illness, really low mental health. We remit the symptomology through treatment, and then we focus on their mental health. A diabetic who's a type 1 diabetic will be a type 1 diabetic. Most type 2s, unless they get early, you can kind of turn it off, but mostly people that are there. But their lifestyle choices will impact their quality of life. And so what I want you to be aware of is, if you see on the right where it says flourishing, reacting, languishing, that's how people's mental health is. And we kind of vacillate back and forth like the weather. Like you get a really good phone call, hey, and a really bad phone call, it's shit. And we got to go up and down as a species. But the question is what can we do to actually have a proactively impact our mental health? Now, there's 3 behaviors we engage in. Pro-social, things that are good for us, that don't hurt other people, good for health. At-risk behaviors, things that we can do that can actually create symptom relief, or help-seeking behaviors. What I want to talk to you about in mental health in the realm of basic things are pro-social behaviors you can do and help-seeking behaviors. You see, we have this thing called stigma. We don't talk about it. See, we have a society, we've created this thing where if someone has an emotional flu for a couple of weeks, that we start judging them. But if someone was in a toilet throwing up for 2 weeks, we would not think twice about it. Yeah, they were really sick, they had a bad bug. But they're still functioning. And what we have done is we've created some parity issues, and we've done it at a macro level. You think about it. You break your leg, go to emergency. You reasonably ought to know there'll be someone there, they'll fix your leg. It might take an hour or two, depending on your level of service and where you're at. But you show up at an emergency with a psychiatric, you may not get the same guarantee you're going to get access for the same level of treatment. So what we're learning as we start to mature is that somehow over the years, because it's invisible, people with mental health challenges or a mental illness, there's something odd about them, like they're different. What many of us don't realize is 70% of all the people with a mental illness have never ever got any treatment. And so the probability, if there's 100 of you on this call, I don't know how many are there, but if there's a bunch of you on here, what happens is pretty sure the ones that are on this call, 20% of you before COVID were struggling with your mental health. And that doesn't mean there's anything wrong with the person. So part of this whole conversation is reducing stigma, start to say, okay, what are the levers we can pull? And then one of the big levers is the environment. So the social determinants of health, what the environment can do to have a positive impact in us is, like, for example, access to medical care, having a job security. I led research with the Mental Health Commission of Canada and the Conference Board of Canada recently, and one of the things I found is that since COVID, there's been an 84% increase in the level of concern in Canada around mental health. But the number one predictor of mental health in Canada is having a job and paying your bills. So we know those social determinants of health, access, and those are important. Now, employers, I work with large employers and large governments and at a senior level, and what we've learned is that employers who pay attention to creating a psychologically safe workplace with intention is not just about, bullying, workplace violence. It's also about creating a place where it's inclusive and people feel welcomed and people feel valued and actually know what their purpose is. When people know what their purpose is from the environment, that can validate, can be like charge the battery. But also we know our physical health is important. We also know social connections are. Isolation and loneliness were a problem before COVID. Now it's creating more stress and strain, more barriers, and disrupted our lifestyle. Authentic, meaningful social connections are probably one of the most important things. Without social connections that we value, we hurt. It's like water. We physiologically, from an evolution perspective, unless you're a psychopath, and that's another course, we need people. People need to feel connected. And so what happens is in the absence of social connection with yourself, which many people forget to build, with casual connections, work, home, personal friends, nuclear family, a new family, or your partner, those 7 relationship types will define our experience of whether we feel lonely. And when people feel lonely, they can hurt, and that can erode their mental health. The other thing is mental fitness, very much like physical fitness. What do you do with intention to promote physical health? See, and the thing is, you don't need to be meditating. You can if you choose to, but there's literally hundreds of things that you can do daily with intention to support your mental health. And again, I'm amazed by how little a person needs to do to have major impact. Like, they come to me for 1 hour a week over 12 weeks, do a little bit of work outside. Again, it's amazing how much of just a little bit can impact your mental health. But what happens is context. See, every day we're kind of interesting. You have between 12 and 60,000 thoughts a day, and you have also what's called a neuro default mode. So while I'm speaking, your brain's wandering 50% of the time. So you want to think about what's going on here from a neurophysics perspective. I'm talking to you, your brain's wandering because there's, it's not that, maybe I'm boring, but most people say I'm not too bad. But the fact is you're in and out. And what happens is these random thoughts keep jumping all the time. And 80% of them, for most people without them, are somewhat judgmental or negative, because we sort to negative before we do positive, many of us, without realizing it. Like, we also live by the 98-2 theory, that 98% of our world's pretty good, 2% sucks. It's interesting, lots of people, will say how hard their life is. And when they ask me, I say, well, how hard do you find it hard, Bill, living in Ottawa by yourself in your townhouse with you and your dog? And go, a lot better than being on a ventilator. It's a lot better than, being in a food bank lineup. There's a lot of people a lot harder off than I am. So yeah, I spent a lot of time by myself because I used to fly 140,000 miles a year and I spoke all over the world. Yeah, my world's changed. but a lot of people are a lot harder than I am. So what happens is, as many of us don't realize, is our brain is to start to throw up these things. We're getting positives and negatives coming at us all the time. And what was interesting, we score through what's called the 98-2 theory. 98's good, 2% sucks. What do we focus on? 2%. And whatever we focus on expands. And some of us are really good at feeling sorry for ourselves. And what happens is, and the reason we do that is we don't know what's going on in our brain, is because what happens is whenever I have something out there, there's a difference between what I want and what I have, and it comes here to my Broca's region, my frontal lobes, and I can't problem solve it. Then what happens is I exhaust trying to solve in the environment, and then there's like a switch flips, and now I'm in my emotional brain, and then I need to actually move emotional coping. And then so when in my emotional brain, I'm stressed out, and this random thought jumps up and says, potato chips, you need some potato chips. And then what happens, my frontal brain goes, no, geez, don't eat that shit, it's not good for you. And then this part of my brain says, potato chips, and the urge starts building. And then before, the only way the person feels they get a relief is go eat the bloody potato chips, because it's easier eating the damn things and listen to that urge. And what people don't realize is a part of your brain called the basal ganglia, that 40 to 60% of all your programming becomes habit. Like, our brains are pretty lazy, so we try to save energy, so we create habits. So as you start to create habits, what people may not realize is their habits could be at risk coping, and we're trying to actually learn how to deal with the challenge ahead of us. And so in essence, all this stuff is happening, and our batteries start to feel drained, and then you add COVID on top of people to keep forgetting, like before COVID, there was all kinds of stress. COVID is added, this has just put a lot of people over the top. And now a lot of people, if you happen to be doing great, that's good for you. But just be open to the possibility some people around you are having a hard time. In my 33 years, I've never seen so much domestic violence, so much suicide, alcohol consumption's gone up, massively, cannabis consumption, like a lot of stuff. When you're in my world, you see stuff that most people don't see. And so what happens is that I try to tell people our decisions can have an impact on us. And though COVID's been hard, and you may today be excited, but there's other people, the majority of the population, 80% of the population's in one of these other 4 buckets, from tentative to being traumatized. So we're all having our own experience. And when we start thinking about it, is what can we do to actually charge our batteries? That's why people like me talk about mental fitness. You see, I'm a big fan of preventative medicine, but in our allopathic medicine model, most people wait till they're sick. And that's why physicians, if you know any physicians, love it when patients come and they do their annual checkups, and do their cancer screening, and do their blood work, and do all the things that can get them upstream before things get too serious. And if they can get to them early, they can help intervene. Well, in the world of mental health, I would certainly rather have this conversation than dealing with someone who is dealing with a severe anxiety disorder or depression. Now, I do really well with people with anxiety and depression because I actually know from my own personal experience how real it is. I have context. I know what fear is. I know what that kind of does to people. And I know that it doesn't seem rational by times. And I understand how thoughts can work on us. And the same thing for addictions. I did my postdoc at UCLA School of Medicine and did a lot of work in writing books on addictive disorders. And I know that mental health and addiction are so synonymous together that people get them confused. And some people are very judgmental. Like, it's almost like a caste system. If an anxiety disorder or you're an alcoholic, well, the alcoholic gets marked down. And what the problem is in society is we need to stop all the labeling and judging. And if we can just actually realize that those people that end up having those challenges, like me, those people, is that they all have to still have mental health. So that what we can do now, shift the conversation to prevention of doing a couple things with intention that can increase our ability to increase our coping, build our resiliency. And resiliency, to be really clear, bouncing back, getting through, pushing through. Really what resiliency is, it's experience, your environment, and education. You want to help someone build their resiliency, and you have kids, let them fail. If you have kids, let them solve some things. I mean, I have 3 teenagers, and I screwed up because I grew up as a poor kid, and I just say, hey, And I worked in Wall Street for 12 years as the chief of staff in a large financial organization. So money was an issue. So I decided I would do all the good stuff for my kids. And what I realized is that I was doing more and I was actually robbing them of opportunity to actually fail. And so when I preach of this kind of stuff is allow people the opportunity, we learn and grow. And failure is not always our enemy. Failure actually gives us an opportunity for learning. But what happens is fear can stop people from trying. That's a different thing. And that's where a lot of people get trapped in their head in mental health. They get stuck in fear. But in essence, if you walk away and say, okay, one thing he said is that mental health is different than mental illness. Got it. So 5 in 5 have mental health. 1 in 5 have a mental illness. Okay. So regardless if you have a mental illness, you still have mental health. Okay, got it. Physical health, you got to do with intention if I want to be in shape. There's no B12 shot to get abs. You got to do something. Same thing with mental health. There's no, you take a course, that's what I get a kick out of it, which I guess as you get older, you get a little bit more direct with people. I had a CEO the other day, so we're going to put all our employees through resiliency. We're going to use your company. I say, no, so what? What's that mean? Do you expect just because you send 2,000 employees and I put them through my team that everyone's mysteriously going to be fine after a 1 hour introduction? Really? Well, keep your money. What we really need people to realize, there is no magic bullet. What we need to do is give people context to realize that they need to do something. Because if you think about human beings, we're a finite resource. We're the only species in the planet. Like I got a new bulldog. I love him to death. His name is Link, and he's off at puppy school right now. Little miniature English bulldog. And it's perfect. I take him on my planes with me. I get everywhere I go when I travel, which I'm not doing right now, but I'm planning for it. Trust me. So the other day we were in the park and he just was running along and I was just playing fetch with him and all of a sudden he just lied down and I walked up and I said, are you shitting me or snoring? How did you go to sleep that fast? What my point is, we humans push ourselves when we're tired. One more thing. But what we don't realize is that when we're at drained, our error ratio for mistakes, cognitive errors, things increase. But when we're charged, our ability to function is higher. But if we come to work every day half charged, that our resource management, it's like getting on going on the highway in cold, and you being, someone would be a risk, anybody that is in your kind of world, risk management is kind of a part of how you operate. Anticipate risk. Well, phone -30, 2-hour drive, no charger, phone's on red. Kind of stupid to go out there and that. So what happens is for us as human beings, is one of the things we do is we don't actually treat ourselves as we do our phones or machines or that. But if we actually are honest and start to realize we can, with just a little bit of work, starting with awareness and intention, just do a little to charge your batteries a bit more. And my role is to say, hey, you don't do this necessarily by yourself. Lots of employers are doing things to create experiences where there's a two-way accountability. So if you're in a workplace, the employer plays a role, the employee plays a role, but what's important for employers to know is that if they provide the program or the policy or the opportunity, that the employee actually needs to do something. Like if you listen to even like this course and take, the 30 minutes to get one idea, well, that one idea, as quick as it came in your head with the forgetting curve, if you don't correct for the forgetting curve, within 3 hours of this talk, you'll lose 25 to 30% of everything I said. If you don't think about it again by, Monday, it's gone. You might remember 2 things. And that's because we don't correct for the forgetting curve, realizing that education and learning are 2 different concepts. Mental health is about learning, and there's no goal line. You're never going to get to the point in your life, you say, like physical health. I can eat pizza and do whatever I want, doesn't matter, unless you give up and you just, you're not worried about anything anymore. But if you want to put yourself in a good place, we need to have intention. So, and why it's one, but one thing I want to make sure you're real clear. There's a lot of numbers there, and I apologize. This one needs to look at 3 with me. That's 3. Days unwell. Charge, days unwell. Even someone with a really high charge. This is based off of a tool that I authored called the Mental Fitness Index. And we have tens and tens of thousands of files. This is an aggregate. This is to give you a case study. What we find is the average high charged employee still will come to work feeling unwell. We call it presentism, the involuntary motivation to come to work, and they still show up. It's like, for example, my mom died. I heard my mom died 5 minutes before a conversation that I was doing one of these talks. And what I realized, it wasn't today, by the way, but a couple months ago. And what I realized is that during that conversation, I got through it. I felt better because I had my mental health is pretty good. And what people don't realize that mental health is really important for you to understand that good feelings come, bad feelings come. Someone with really good mental health understands that fighting negative feelings is a part of life. They just allow them, they come and trying to fight them, fighting away that I'm feeling grief about my mom, other than just experience loss and grief. It sucks. I lost my mom. And it's going to take me some time. And when I think about it now, it sucks. So what happens is that we need to understand that there's not a utopia perfect state. That's one of the problems with our society. We are sadly, in North America, especially, we are in the quick fix. If we don't have a pill or something fixed, we don't realize that life is hard, but life is joyful. There are good days and there's bad days, and that's just a part of the deal. Like the Dalai Lama would say, not that I hang out with a dude, but he would tell you that that's one of his biggest criticisms of our culture is that we don't understand that a life, where does it say that every day is supposed to be perfect or we're always supposed to be happy? And we're being down, where does it say that that's not a good thing for us? Because being down gives us a chance for reflection and insight if we're paying attention to what's happening versus trying to run away from it. So the concept around mental health is, but notice that the difference now between someone at charged to half charged to empty. So the point is that our experience, mental health impacts how we show up in our experience. And so what I really want you to know is under stress, we can go to, we have these pro-social behaviors, we have at risk and help seeking. 2 of the 3 are good for you. What we want people to realize, so some self-compassion. So instead of judging ourselves, like there's so much shame when people drink or like somebody goes say, like they wait till someone goes to bed and then they run potato chips. They want to eat when no one sees them because we've labeled all this. But the real thing is the first step is just be aware of what you're doing. Then the second step is try to do just a little bit more to see if you can actually start to take control of things that are, instead of it controlling you. If it's controlling you and you can't stop, that's what people like me we're trained on helping people learn how to get through these types of things. But if you want to charge your battery, and then with intention, what we can do is get people to say, if I want to improve my mental health, then what am I doing for pro-social? Now, this whole help-seeking behavior, why it's important, like I have a car outside. If I go out and I go press the button in the car, I reasonably ought to know if the car doesn't start and it doesn't work, I need to call a mechanic because I'm really technically not inclined. So I called AAA. I already know when my car brakes in the parking lot, doesn't start, call AAA. Don't have to think about it. Now, if I'm not feeling good, I'm feeling overwhelmed, I have a psychiatrist and I have a psychologist. Both of them over the years have become pretty good friends, so they're both in speed dial. But I know who I'm going to call. The point is that we know that people, sadly, in the first 5 to 7 minutes of needing help, they don't know who to call. And then they often just won't do it. But what's important for you to really know is that any one of us, at any point in time, something could happen and we can get into what a suicide ideation. Even the most strongest, confident person, something can happen and get them here. As long as they remember an anchor in their head up here like CAA, if I get over here and I have some of these thoughts, that really what we need to challenge. We have no hope. In the absence of hope, human beings have nothing. It's really simply say to yourself, hey, just because I don't know the answer doesn't mean there's not an answer. And that's what we need to start helping anchor people to understand is just because you don't know the answer doesn't mean there's not an answer. And it's really important to have So if you're a professional working with people, for you and your family, if you get in trouble, who do you call? And if you don't, make that a part of a micro skill to figure out who you call so you know what your support systems are. And what we need to do, what I'm going to click through is say to you, okay, I'm going to take about 5 minutes and then I'm going to take some questions. And then I'd like you to start to say, so really for this, mental fitness is really simply being aware of appreciating what we have in place, doing something for our body, making sure we have social connections, and making sure we do something. And when I say making sure, we focus like intention. Like if I want to get physically fit, I make sure I do my Stairmaster. I make sure water or Coke, water. Bedtime, I make sure I get my sleep because I know sleep's critical. See, it's about making decisions, one decision at a time. It's not about, oh, this is hard. I don't have enough time to do this. No. It's amazing what human beings, if they just walk 20 minutes a day, drink a little bit more water and get to bed a little bit earlier, how that can have a positive impact, let alone getting any of the other techniques going. And so when you start to go through this, is if you have any part of your life where there's a challenge, it's easy. For me, this is an example of my mental fitness plan. It's not really that glamorous. It's quite simple, but living with a mental health issue and living with challenges, I take this stuff really serious because it, I'd kind of like to be able to role model some. And so, be somewhat healthy so that I believe that the stuff actually works some. And, I'm 57 years old and I don't plan on quitting tomorrow. So I feel I got another 30 years of me doing what I'm doing. So in my head, what the investments I make today are going. I mean, me retiring, what the hell would I do with myself? Like I only golf so much and boat so much, and I do both now. So what I want to be able to do is in my head, I find what gives me my joy is talking, because if I can help one person, because one person helped me. Because if I didn't have one conversation by one person when I was 18, I wouldn't be where I'm at now. I know what that conversation was. And so what happens is we all have opportunity. The mental fitness around gratitude, I practice gratitude a lot now in COVID because I realize that when I start thoughts in my head how hard it is, I just pause and say, I wonder how hard it is in the other parts of the world. I turn on CNN, I see people in 6-mile lineups for food banks. I'm thinking to myself, wow, how blessed am I? So focusing, Yale and Harvard both have studies showing the power of appreciative inquiry, focusing on daily. What it does, it can activate a part of our brain, a reptilian activating center. So for example, I'll give you something you all know. If you buy a yellow punch buggy, what do you start noticing? Yellow punch buggies. If you start focusing on positive with intention through gratitude, what do you start noticing? Positive, to try to outweigh that automatic part of our brains that can be negative. I journal emotions because of I want to track myself, because we're sometimes not objective. Like we can actually, someone goes, how was your week? And they say, oh, it was terrible. And they start asking, tell me what happened. Well, Tuesday at 3 o'clock, I had this conversation with Jim, who was a complete asshole. Okay. So the rest of the week was terrible because that was your hyper focus. They didn't allow themselves the opportunity to possibly enjoy Wednesday and Thursday and Friday because that conversation. And I know most people relate to what I'm saying. Meditation, I don't do 10 hours of meditation. Believe it or not, I'm pretty lazy. I do a 90-second meditation every day. And I'm lazy. I mean, I said to myself, I understood what it is. It's I get neuroplasticity benefits from being able to actually stop and allow myself to find boredom. That's what I call it. Because I'm ADHD, my brain runs a lot too with anxiety, so I'm going all the time. So if I just wheel around and take 10 minutes, not really, no, 2 minutes, 90 seconds is usually my tops. It's just a wheel out the window and I just look out the window, I start noticing some stuff. I know what I'm doing. I'm not racing in the past. I'm not thinking about my next meeting. I'm not worried about anything. For a minute, I'm just allowing myself. And what people don't realize, your sympathetic nervous system, you can have, the only time that system really turns off and goes into the parasympathetic nervous system is when you're sleeping, with deep REM. Well, meditation is a great way of helping from a neurophysic perspective, allowing your stress responses kind of cool as jets. And so there's little things we can do, trickery, there's all kinds. I wrote about 300 articles in Globe and Mail and stuff. There's all kinds of stuff out there that can be helpful. The trick for you, what I want you to get from here is just, if you pick under mental fitness, like something you can do with intention, pro-social behavior, something you enjoy doing that's good for you for 5 minutes a day. Read, draw, garden, write, anything, whatever it is, coach, talk, anything you get joy from that's good for you, that doesn't hurt anyone else, that promotes health. That's what mental fitness is doing things to charge your battery with intention versus I have to work one more email, one more this, one more that, the treadmill, which becomes a drain. And some people, sadly, because they're social connections, because they're lonely and isolated, some people are in marriages where they're lonely. And so what they do is they use work as an outlet and they become workaholics because they say, I have to work, because they are hiding from the reality they're in a relationship they don't feel fulfilled. And so part of what I try to get people to be aware of is, hey, just be mindful of what you're doing. And your life doesn't have to be perfect, but be aware of what's draining my battery, what's charging my battery. Just start with those fairly basic things and pick one or two things at the most and focus on it for 3 months. And someone goes, how long does all this stuff take, Bill, to get mental health? And what's going to happen is I'm going to go click through this real quick. You get a chance to have a white paper. I have no intention to try to teach you how to build a mental fitness plan right now, but I want to give you a quick frame of reference how easy it is. And the answer to the question is, it can take up to 200-300 days to get something unconscious and this. I can learn a habit in 21 days. I don't really believe it. Habits are formed the following ways. You need to have your motivator, your stimuli, your routine, and your reward. Going from potato chips to celery takes some time because some people, because the potato chips were really good, the celery wasn't so good. So it takes some time for the urges to go down, then to get the benefits. So when you're starting to do all this stuff, it's important for us to just pick one area, whether it's a little bit more sleep or a little bit more movement or something that's pro-social. So just pick an area. So sorry, I went to this clicker thing. So what I'm going to do, I apologize about the clicker thing. This 6-step model, we're going to take some questions in a sec, is going to be in a white paper. And what it really is just to give you a frame of reference to walk you through a quick little plan on how to do it. You don't need, but you can do this on the back of an envelope. What you can really do is this. What's the slide? Is this the slide I want to get to? Is just really pick one area and kind of just focus on that. That's really where you start. So with that, let's take some questions for a few minutes before we run out of time, and then we'll see if we can get you on with your great conference.
Thank you very much, Bill, for your presentation. That's very insightful. I'm sure we can all take away a lot from that. We do have a couple of questions lined up, so I'll just get to them. This one's quite long, but I'm just going to read it out. I'm concerned for the mental health of our frontline security staff working within acute care and the accumulative effects significant single events have CISM programs to address of seeing or dealing with tragedy, death, violence, people at their worst, etc. every day. How can I better support these staff? Are there courses like mental health or R2MR or another any good?
Yeah, I think a part of it is I'm familiar with all of those. I try to get a couple of things. One is there's a concept around it, and I can relate to some of this because I did it for quite a while. So we sometimes confuse burnout and compassion fatigue and cumulative stress that could put a person at risk for acute stress disorder. So what happens is when a person gets all kinds of exposure to significant emotional events, they can, I just finished creating an instrument, I'll let you all know, with PSHSA and first responders for province of Ontario on operational stress injuries. So I created the first tool for early diagnosing of operational stress injuries. And it's not a diagnostic, it's an informed educational screening tool. So what I've learned is, to answer the question is that what I would do, if I were you, I would give them a frame of reference, first of all, on mental health and the pro-social behaviors that they can do to build their battery. Then the second thing I would be doing, I'd be evaluating with them what programs are actually working to help from the environment to charge the battery. That's it. Then I would make sure that my folks, I didn't create confusion, because one of the challenges with first responders or people that are being exposed to it is the debriefing process. And I know this because I was trained with Mitchell and Everly, that's how old I am, is that when you get to the core of it, you need to not, you can't assume that everybody, that model's working for everybody. You need to be able to, if you're going to start to do it, is the debriefing element before, if you need to do diffusing element before you get to the debriefing element, you need to be able to provide elements in that debriefing strategy, which is the 5-10 minutes to get people stabilized for your 24/7 hours after events where you're going to do this, is do I need to give them the same thing? Because depending on how they're processing it, we need to be careful of it, because what I have found is some people that are doing this don't have a psychological background and they actually don't know what they're doing with imprinting. And so what a part of it is ensuring that the folks that are doing this actually have some real understanding of what's happening. Like, I can tell you as a clinician, I've walked in on these things and I've seen people disassociate it, and no one in the room knew they were disassociated other than me. And so what happens is, of people that are experiencing PTSD and those things, they can go through different signs that the layperson just doesn't see. So my point is in this, so without getting into a bunch of the clinical stuff, is that we need to not assume that one strategy is going to work. The road to mental readiness, and what my challenge with that program, I'll be very honest, that SMART goals and 3 other micro skills, they're good, but there's 100 other things people could be doing. I would rather introduce someone to the concept around mental fitness and then give them a bank of micro skills to do. Definitely in making sure they understand, when you see the white paper, the difference when you're working at unconscious level and conscious level, what you're trying to do. That's important. And then give people that frame of reference. The continuum can be helpful for sure, but I want to remove the pathology or when people think they're broken. You can be discouraged and it can impact your functionality. But if I told you the number of people who were diagnosed and came to me saying they had PTSD that didn't, they had depression or something else, you'd be in shock. And so what happens is that a lot of the times too, is that, you know, someone to go through to get a diagnosis for PTSD and these things, that could take months. It doesn't happen like by next Tuesday. I'm not talking about delayed onset. I'm just talking about from real time to real time. And so the whole concept around anybody within the first 30 days, a lot of the symptomology is normal, but we don't help people understand how it's very much like a bruise. A lot of times these things people can unwind. That's why that's why World Trade, I was working in Wall Street during World Trade. And it's amazing, you know, you think about people are exposed to watching car accidents and bad stuff, news, how small a percentage of the population that don't. What you're saying is really important, is that a cumulative part. So that means they're getting more things that are draining their battery. What they can do from a preventive perspective is help them do things daily to increase their charge, so if they get a drain, it can reduce it. But you get the right kid, right wife, or someone that reminds you or something like that, these things, even the person you never expected, that could be the tipping point. So it's a bigger conversation, but it's a great conversation you're having. I'm encouraging you're doing. I would ask you to move to evidence more, and realize that just another program's not going to do it. Do your evidence. Get your evidence.
Thank you, Bill. We maybe have time for one more quick question. What advice would you have for healthcare security professionals who are mentally exhausted, experiencing COVID fatigue as the pandemic continues?
Yeah, I think what the reality is realize we're going to get through it. But the part of it is that if your batteries are being drained, what can we do to charge your battery? So I would get my teams working on mental fitness. I'd make sure they understand what compassion fatigue is, because compassion fatigue and ultimately is the inability to they lose the ability to feel empathy. And they start to really, it's challenging for them. It's frightening for them because it goes against their value construct. So they get incongruency, and they can start with both self-compassion and be really hard on themselves. And so you have a lot of males types, and males aren't so good. You know, I'm not saying there's not females, but there's a lot of this attracts males in security world, police world, and all that kind of stuff. And males aren't really good at dealing with emotion. So it's important to give them a frame of reference, exactly what's happening, so they can normalize it. So mental fitness, compassion, fatigue, important they understand it. And so they actually understand where they're at, so they can actually put themselves in a lot. If I'll give you there's a blog I write with the CEO of the Mental Health Commission of Canada. And if you ask someone in my team to send it to you, it'll give you all kinds of articles for leaders on compassion fatigue, burnout, managing, setting boundaries for leaders, what leaders can do during COVID to help them deal with some of the challenges.